Decoding COVID. Handling COVID-19 is very simple and easy. It is a simple disease. COVID-19 turns into a scary pandemic because not understanding the COVID-19 disease cycle with clarity and ignoring the importance of origin and nature of core factor misfolded protein, which is responsible for severity of the infection, and implementation of therapy procedures ignoring above two factors leads to COVID-19 into a scary pandemic. If we know the COVID-19 disease cycle with clarity and consider the core factor misfolded protein MFP, which is responsible for severity of the disease, and framing the therapy procedure considering above two factors, turns to COVID into a very simple disease. There are many curious and confusing points in COVID. Hyperactive immune response, cytokine storm, silent hypoxia, hyperinflammation, severity of the disease while very low viral load, long-term side effects in recovered patients, neurological, psychological, cardiological, etc. The following compilation gives clear clarification for above all puzzling points and outline the necessary changes in therapy. In common concept, in COVID-19 disease cycle, there is a single pathogen is present, it is SARS-CoV-2 virus. But in fact, in reality, in COVID-19 disease cycle, there are two pathogens are present. One is SARS-CoV-2 virus and another one is misfolded protein. SARS-CoV-2 virus causes respiratory syndrome and misfolded protein causes hyperinflammatory systemic syndrome. The COVID-19 disease, the infection timeline is classified into three stages. Stage 1 general body infection, stage 2 pulmonary infection, and the stage 3 hyperinflammatory systemic infection. The stage 1 and 2 general body infection and pulmonary infection was caused by virus, but the stage 3 hyperinflammatory systemic infection was caused by misfolded proteins or prions. Stage 1 general body infection. Symptoms of the stage is mild. Symptoms are cold, cough, loss of smell, fever, general discomfort, etc. Symptoms are appears around from 5 to 7 days. The viral load is very high in this stage, around 75%. Most people recover from this stage with simple medications. Stage 2, it is called as pulmonary infection stage. Symptoms are moderate, high fever, pneumonia-like symptoms, damage of respiratory organs, lungs, etc. Active immune response against to virus particles, inflammation, shortness in breath without hypoxia in starting stages and gradually leads to shortness in breath with hypoxia. External oxygen supply is needed. Symptoms are appears from around 7 to 12 days. The viral load is lower than stage 1, around 25%. The high viral load formed in stage 1 and stage 2 infects and damages the respiratory system. All the symptoms appears in the stage 2 are purely related to the respiratory system. Stage 3, hyperinflammatory systemic infection stage. Symptoms are very severe in this stage. Hyperactive immune response, cytokine storm, the overactive immune system releases huge amount of cytokines in a stream-like manner. This is the characteristic feature of this stage. Hyperactive immune response and high inflammation, shortness in breath, oxidative stress are striking features of this stage, and the symptoms are appears around from day 12. The viral load is lower than stage 1 and stage 2, around 5% or less. The symptoms of the stage 2 and stage 3 seems very similar, but their origin and pathophysiology is totally different. We will discuss about it later. When we carefully observe the disease timeline, the viral load in stage 1 is very high and gradually decreases from stage 1 to stage 3. In stage 1, the viral load is very high and gradually decreases to stage 2, it is around 25%. In stage 3, the viral load is decreases very low, it is 5%. But the infection severity is gradually increases from stage 1 to stage 3. Generally, in viral infections, the rate of infection is proportional to the viral load. When the viral load is decreases, the infection severity is also decreases and symptoms are gradually disappears. But here in COVID-19, at stage 3, the viral load is lower than stage 1 and stage 2, but the severity of the infection is very high in stage 3 and symptoms are very intense, severe and persistent. The curious point is why the infection is severe in stage 3 while the viral load is low. This is the curious point in COVID-19. The answer is, the reason is misfolded proteins, misfolded viral proteins. What are misfolded proteins? We will now discuss and how they are formed, how they are origin and what are the properties. First we will discuss about the origin of misfolded proteins, genesis of misfolded proteins. First we will discuss about the origin of misfolded proteins or genesis of misfolded proteins in COVID-19. Let's start. COVID-19 is a single stranded RNA virus with positive sense. Its previous host is bats. It resides in bats for a long time and transmitted to humans by the process of spillover. Then it is transmitted from human to human. During the time of replication in humans, SARS-CoV-2 virus sometimes undergoes some stressful conditions. During that stressful conditions, some viral proteins not folded in a proper way, normal way, they are folded in a different way. They are called as misfolded proteins. Misfolded proteins means the viral proteins not folded in a normal way. The polypeptide chain of the viral protein not folded into a protein in a the polypeptide chain is folded into a protein in a different way than normal three-dimensional way. The viral proteins which are not folded in a normal way, they are called as misfolded proteins. They are simply called as MFP. The MFP structure is totally different from normal viral proteins. These MFPs are not performs any functions of the viral proteins. Most importantly, the MFPs are very hard, heat tolerant up to 200 degrees and above and resistant to immune system. The immune system does not show any minimum impact on these misfolded proteins. They are totally resistant to immune system. These misfolded proteins sometimes having replication capacity, they are called as prions. These MFPs are totally new structure. They are not similar to the virus proteins or not similar to the human body proteins. These misfolded proteins are very new to the human immune system. Human immune system never seen this kind of MFP because it is not like a viral protein or not like a human protein. It is like a strange alien protein to the human immune system. Now, we will discuss the stage 3 severity regions. The misfolded proteins, the stage 3 severity the symptoms of the stage 3, striking symptoms of the stage 3 are hyperactive immune response, cytokine storm, oxidative stress and hyperinflammation. These three are the striking features of stage 3. Reasons for these stage 3 symptoms are very confusing and curious and puzzling point, and for the real reason for stage 3 symptoms is the misfolded proteins are responsible for all the symptoms appears in stage 3. Misfolded proteins are the only factors which are all the symptoms appears in stage 3. The striking feature of stage 3 is hyperactive immune response or cytokine storm. During at severe conditions in COVID-19 infection at stage 3, the human immune system becomes hyperactivated, overactivated and triggers the releasing of huge amount of cytokines. Even the absence of virus in the body or low viral load in the body. Why the human immune system overactivated at this stage and triggers releasing of huge amount of cytokines is the very curious point, very confusing point, puzzling point in COVID-19 infection. This cytokines reaches to the various parts of the body and damages those parts. This is the real cause for severity of the disease in COVID-19. The curious point is, what is the reason for cytokine storm and hyperactive immune system? Let us explain. The misfolded proteins are very new to the immune system. The human immune system never seen this kind of misfolded proteins because it is not like a viral protein or not like a human protein. It is like a strange alien protein to human immune system. To counter this misfolded proteins, the immune system becomes hyperactivated and releases very high amount of cytokines. But the misfolded proteins are very hard, heat tolerant and immune resistant. The immune system does not show any minimum impact on this misfolded proteins. So, the continuously a stream of cytokines are formed. This is the reason for cytokine storm in stage 3. This is the reason for hyperactive immune response in stage 3 at severe conditions. Reasons for oxidative stress or hypoxia in stage 3. The immune system hyperactivated by misfolded proteins and forms cytokines. These cytokines leads to formation of free radicals. The free radicals reacts with available oxygen and make unavailability to the oxygen to the body. This is the reason for hypoxia in the stage 3. The external oxygen supply is also not sufficient to overcome this oxidative stress. Reason for silent hypoxia. Silent hypoxia or happy hypoxia. It is also a curious and confusing point in COVID-19. In some COVID-19 patients, the abnormal decrease of oxygen levels in the body without showing any external signs like shortness in breath or damage of lungs, etc. Reason for silent hypoxia is when the misfolded proteins binds to the nervous system, it activates the neuroimmune system, and neuroimmune system activates by glial cells and microglial cells and releases cytokines. These cytokines promotes the formation of free radicals in the nervous system. These free radicals formed in the nervous system reacts with available oxygen and make unavailability of the oxygen to brain and nervous system. Actually, nervous system and brain requires more than 20% of the oxygen in the human body. This is the reason for silent hypoxia in stage 3. Hyperinflammation in severe conditions. It is also a very curious and puzzling point. Why the hyperinflammation caused with even the low viral load in the body? The reason is explained now. The misfolded proteins binds to various tissues in the human tissues, and the human immune system responds and releases cytokines. But the misfolded proteins are resistant to immune system and it continuously forms a stream of cytokines are formed. These cytokines leads to formation of free radicals. The free radicals damages surrounding tissues, which causes hyperinflammation. Differences between stage 2 and stage 3 symptoms. The symptoms of the stage 2 and stage 3 seems very similar. In both stages, inflammation, immune response, oxidative stress are present, but their origin and pathophysiology is totally different. All the stage 2 symptoms are responsible for virus. SARS-CoV-2 virus is responsible for all the stage 2 symptoms in pulmonary infection, but misfolded proteins is responsible for stage 3 symptoms. In stage 2, inflammation is caused by virus particles which is replicates and damaged in the respiratory system. It is a pulmonary inflammation, but in stage 3 inflammation is caused by misfolded proteins. In stage 2, the immune response is against to virus particles, but in stage 3 the immune response is against to misfolded proteins. In stage 2, oxidative stress in stage 2 caused due to the damage of respiratory system due to the replication of viral particles, but in stage 3 oxidative stress is caused by formation of free radicals which utilizes the available oxygen in the body. Treatment and therapy. SARS-CoV-2 virus is not a harmful virus until it forms the misfolded proteins. If the virus not produce misfolded proteins, the patient is not enters into the stage 3, the severe hyperinflammatory stage. If the virus is not formed MFP, misfolded proteins, it is just like a cold and flu virus. The total therapy target is preventing a patient entering into the stage 3. That means preventing the formation of misfolded proteins. How to prevent the formation of misfolded proteins in COVID-19 infection timeline? It is very simple. Chaperones. Chaperones are the molecules which prevents the protein misfolding and helps the proteins into fold proper way. Repeating, chaperones are the molecules which prevent the protein misfolding and helps the protein to fold in a proper way. Selecting the pharmacological chaperones which are also having antiviral property giving good result. Example such chaperones having chaperonic activity along with antiviral activities are trehalose, TUDCA, PBA, 4-phenylbutyric acid, cyclosporins, etc. Cyclosporin is actually it is used as a immunomodulator in COVID-19 treatment, but it is also having another two properties. It is a antiviral. It is also having antiviral property. It is also having chaperonic property also. A lot of research is required in this field. Therapy for stage 1 and 2. Antiviral therapy along with pharmacological chaperone therapy in combination. When we use the chaperones from stage 1 onwards, they prevent the misfolding of viral proteins, which leads to preventing to entering into the stage 3, gives a good result. Therapy for stage 3, severe hyperinflammatory stage. This stage should be treated with anti-prion compounds which prevents the effects of misfolded proteins. Examples such compounds are TUDCA, PBA, 4-phenylbutyric acid, polythiophene, Scottleria herb extract, etc. and also antioxidants. In stage 3, huge amount of free radicals are formed. To prevent the damage caused by free radicals, we should use sufficient doses of antioxidants in stage 3 and also immune modulators. In stage 3, huge amount of cytokines are formed, everybody knows. To reduce the effect of cytokines storm, immunomodulators are very useful. Neurotrophic supplements. These misfolded proteins are very affinity to the nervous system. They are binds to the nervous system and damage the nerve cells. To prevent the damage of the nervous system, neurotropic supplements and nervines are very useful. Thank you.